This will be where the royalty-free music comes in.
And I can't get called for copyright on it. Drop, drop, drop the head. Good. A breath in for me. All the way out. Good. All the way out. Good, good. Nice. Okay, there was a big one there too. Good stuff. Rob, good to see you again, man.
Nice
it's been a minute. What are you in for today?
I'm in for just kind of an overall sort of thing. I tend to have issues with behind my shoulder blade and my lower back primarily. I actually have been having some issues with my left ankle as well, if there's something we could do with that.
Yeah, of course. There's always something we can do. So you've seen a chiropractor before, right? And I know that you were mentioning off camera just a little bit that you do have... You've seen a chiropractor before. This is the first time seeing me. That you do have a bit of a hip alignment issue. So what's going on there to the best of your knowledge?
To the best of my knowledge, my hips tends to, on the right side, push forward a little bit, and then sort of shift up a little bit and makes things a little bit uneven.
All right.
There are times where I can even just stand there and feel that one leg is shorter than the other, and I can feel how off balance I am. Okay,
yeah. So there are two different kinds of what Rob here is referring to as a leg length discrepancy. Okay, there's a structural and there's a functional leg length inequality. So a structural leg length inequality is it's another word for anatomical, which means that, like, yes, genuinely he has one leg bone that is longer than the other leg bone, and the only way to figure that out is to actually get x-rays of both legs and then to bust out the tape measure. That's not that common, okay? It's pretty rare. Most leg length inequalities are actually caused by something known as a functional leg length inequality. What does that mean? That means that you could get restrictions or tightness on one side of your body that then leads to some kind of hip hiking, and then you're standing at a weird angle that results in having the perceived difference in leg length. So that's probably what we're dealing with in this sense, just statistically. Again, I haven't examined him before. I have not taken full leg length x-rays, and I'm not going to do that here today because I think it's completely unnecessary. But okay, so now you're saying which hip is hiked shorter or which hip is longer?
Right side tends to shift up, I guess.
Okay, right side tends to shift up, and you have a left-sided ankle issue then, okay? Yeah. So one theory is that if his right side is hiked up and his left side is hiked down, he's putting more pressure down through the left foot, resulting in left ankle issues. That's one theory just off the top there, but it's interesting to see how everything in the lower chain can come back to position of the hips in certain circumstances. So what's going on with that? You said the shoulder?
Yeah, so the shoulder, I think it all stems from knots in my back.
Okay.
I am a drummer.
Okay.
And with drumming posture, you're sort of with your right arm across your body forward a little bit. So I feel like just years of that posture where I'm sort of favoring and twisted a little bit with that right shoulder sort of pulling me.
Will eventually add up. Okay.
I feel like that's sort of just become part of the issue.
Okay, fair. So Rob was just saying that he thinks that a lot of that right-sided tightness is due to the nature of being a drummer when you're heavily rotated off to one side. Totally possible. We get asymmetries based off of sport all the time. It's totally possible that we can also get it due to art or music. A lot of people, even writing too much with one side, can cause issues with that associated shoulder blade. So again, entirely possible there. Anything going on with the neck at all, or has that been like, okay?
The neck has been all right recently. A couple of nights I've woken up actually to like tension-related headaches. I don't know if that is necessarily my pillow or it could have just been my neck is just bad and I was sleeping like that and didn't realize it or something. But
when was the last time that happened for you?
A couple weeks ago.
Yeah, and since then it's been okay?
Yeah, it was like 2 or 3 days in a row, and then after that it's been fine since.
Okay.
But better safe than sorry, right?
All right, no, well, we can absolutely take a look at all of that then. So what we'll do today is we'll screen through the hip region, okay, the low back, the SIs, We'll take a look at that ankle, see if that has in fact become impacted by the lowering of that, or the perceived lowering of that left hip. Work through kind of that shoulder and upper back area, and also screen the neck if there's any kind of residual tightness there. All right. Anything I missed? Is there anything else you want to mention before we get started?
I don't think so.
No?
I think that's all the sort of trouble spots I can
Perfect. Okay, so yeah, what we're going to do today is we're just going to get a physical exam out of the way, and then we'll get to it.
Cool,
Okay.
sounds good.
We're going to screen Rob from head to toe. Here, quite literally toe, because he mentioned he had an ankle thing. But we're going to start with your head here, so face forward. I guess you bring your chin down to your chest for me. Does that trigger any kind of neck discomfort or any of that kind of... Was that right-sided, like, scap pain you were mentioning?
I didn't feel any pain that way, but I could definitely feel that it didn't feel balanced.
Okay, all right. So elaborate on that a little bit. Like, what side feels more...
Like when I just brought my head down like that, it felt like my entire right side
is getting pulled forward.
Pull and come with me.
Got it. Okay, now I want you to look up towards the ceiling, please. Any discomfort with that?
No.
No? Okay, good. Face forward. I want you to rotate as far as you can to the right. Your head. Yeah, I'm going to keep your shoulders square.
Wait. Rotate my head right? Am
I
turning?
Rotate.
Okay.
There you go.
Okay.
You didn't see the hands. The hand is
I did not see the hand.
Okay, and we're able to get to about 70, 75 degrees. Now as far as you can to the left, please. This side over here, good. We're able to get to 50, 60. So a little bit of a decrease. You can come back to neutral. To the left rotation, which would also suggest that we're getting right-sided tension because it's not letting him turn that far. So that kind of coincides with the feeling of getting pulled forward as well on that forward head flexion. Give yourself a tight hug, okay? You've probably earned it. Tight hug, good. And I want you to rotate as far as you can. What was that laugh? Like, no, I didn't earn this at all. Like, okay.
It was that laugh.
Oh my god. Okay, sorry, one more time. Rotate, rotates. And we can get to like 80 degrees. That's pretty good on the thoracic rotation. Now let's go the other way. Rotate, rotate. What was that?
That was the pants.
Okay. Ripped. Got him. All right, good. Okay, so we're equal on the thoracic rotation there too. Good, good. Stand up for me if you please. I want you to bend down, touch your toes if at all possible. Okay, so he's able to touch the toes. He's touching there. I'm going to need you to come back up for me and bend backwards, please. Any discomfort with either of those movements?
No, but I did hear two very small pops.
Pop, pop?
Yeah.
Great. So now we don't have them on the mic. Darn it. I'm kidding. No, it's fine. Every good low back exam will start with some of our more common tests, global tests. So we're going to start with the classic straight leg raise here. Which side, you said, sorry, which side was the lower one? Or the higher one's the right side.
The higher one is the right side.
The left is lower, right? Okay, so let's actually start with the left side. Why not? I'm going to bring this leg straight up as high as it will go. And we will find that you actually have quite good mobility. We can get up to about 80 degrees there. Now with that, you look like this is actually a little uncomfy.
Just a hair.
Just a hair. Okay. So are you getting any low back discomfort with that, or is it limited to behind the leg?
To behind the leg.
Behind the leg. Okay, now slowly lower down, slowly lower down. Does that cause anything in the low back?
No.
No? All right. Now we're going to do the same deal on this side. We're going to bring it straight up. Any discomfort there? Okay, wow.
Yeah.
Just behind the leg or in the back?
A little bit around the back, too.
In the back, eh?
Just a hair.
Interesting. Okay, slowly lower down. Does that cause any pain?
No.
Now, I've noticed that you're quite shaky with that. Is that normal with you, or?
I don't think so.
Okay, because like you seems like you were struggling a little bit with that movement. Yeah. So when we do have somebody who's shaky, like first off, having those shakes, like I get them too on certain movements. It's quite common that they happen. They can be completely benign, all right? But it can also be an indication that we are stressing some muscles in ways that they are not used to being stressed, or they're not conditioned to be stressed with. So if you are getting low back discomfort on that right side and bringing the leg up, did you get anything actually zing down into the foot at all, or no?
No.
No? Okay, do you want to try one more time? Because
you
look a little confused there. So let's try one more time. Bring this all the way up. Do we get any kind of zinging all the way into the foot at all, or no? Or down the back of the leg past the knee?
No.
No? Okay.
The back of the knee is sort of where everything seems to...
Okay, yeah. So we'll lower that down. The straight leg raise, all right, tests for discal problems, specifically radiculopathy, which is that nervy zinging that I was alluding to there. But in somebody who does not have a disc problem, they'll usually be limited by hamstring tightness or hamstring tension, which usually, again, presents behind the knee because that's where the hamstring inserts into. Alternatively, you can also get low back pain on this if it's more of a low back paraspinal issue, which is more obvious on the lowering if that aggravates the complaint. So let's actually bring this up one last time. Sorry we're making such a big deal of this. Now slowly lower it down. Does that cause any low back discomfort as you lower it down?
No.
No? Okay. So if that's the case, not really a low back issue with that either, but we're still going to need to test the SI joints out because, again, that test doesn't do anything for the SI. So I'm going to bring this up, and I'm going to place behind here. Now, does that cause any discomfort there at all?
No.
No? Good, good. We're going to bring this up, Does this cause any discomfort at all?
No.
No? Good stuff. Bring the hips up. You got pretty good hip internal rotation. That's good. Any discomfort with any of those movements?
Not discomfort, but I almost felt like it was setting to release.
So
you were doing that.
In that last movement
Yeah,
there?
like at the very last second.
Okay.
It felt like it was setting.
So it was the external rotation that kind of triggered that. We're going to bring this up. That's okay?
Mm-hmm.
Okay. Good. And that's okay too?
Mm-hmm.
Good stuff. All right. All right, so Rob was mentioning that he feels like he's got repeated left ankle issues. That's correct, right? So
yes.
could you elaborate on that just a little bit for me, if you don't mind?
I have sprained both of these ankles several times over the course of my life.
All right.
And because of that, I feel like I've lost a lot of flexibility over time.
Okay.
In fact, in the past couple of days, even just like sitting, I've felt tension and stress in that left ankle.
And when you say ankle, are you referring to this region here?
There and a little bit more to the right, sort of surrounding the bone.
What, my right or yours?
Yeah, your right, my left. Yeah, right
okay,
around
so
there.
right around there.
Yeah.
Okay. So he is referring to what's referred to as the ankle mortise joint, or where the tibia comes down to connect into the talus bone. To test difference in dorsiflexion ability, his ability to lift his foot upward will be limited by any kind of present restrictions within the ankle mortise joint. So what that means is that I want you to try to lift both of your feet, just the feet, mind you, up towards your head for me. Okay, go, 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 go. Now on camera, that can be a little bit hard to see, but we do have a little bit of reduction on this side as compared to left. But we're talking just a few degrees. Okay, so is that the main thing? No, probably not. But we're gonna try to adjust in through that ankle mortise joint now to clear up the feeling of tightness that he was having in that region. Now there's several ways to adjust an ankle. I'm gonna try one way. If it doesn't work that way, we're gonna try it a different way. So what I need from you there, Rob, is I need you to lightly grip the table for me, because quite literally I'm going to be pulling like this, and I could pull you off the table if you're not gripping onto it. So good news is he's got it up there trying to hold back a laugh, and I'm gonna go ahead, take the mic, and I'm gonna shut up so hopefully it can pick that up. So just relax the ankle as best you can for me, okay? Good. My hand slipped right off that. Let's try one more time. There we go. That's all there is to it. How was that?
Good.
Good. Happy to hear. Ooh, yeah, okay, so that right side is definitely locked up as compared to the left side. I can tell that pretty easily right off the bat. So when the hands are on the lower back region here, bottom of the spine is the sacrum. Connected to the sacrum is the iliums, or the hip bones proper. The SI joint connects those things. When I put my hands on someone's low back here, I am testing for springiness of that joint, for which, when we compare the two, right side less bounce than left. Would you agree there?
Oh, I can feel it.
Okay, perfect. All right, so we're in agreement there. We can take care of that today, no problem. All right. And you mentioned it is also the right side up here that has kind of that knot and is very tight. Feels like it's getting pulled forward. So let's feel through all this. Kind of right there's one. There too. Okay. Take a big breath in for me, all the way out. Okay, in, all the way out. A little challenging to get you there. So we got a really restricted right SI on Rob here. We're gonna do our best to try to move it. Might be a little challenging, but let's hope for the best here. I'm gonna pull, good, hold right there. Scooch your hips towards me, please. Awesome, okay. Now what I need from you is to just, I'm gonna get you to take a big breath in, big breath out. And when you are exhaling, I want you to just push it all out.
Just a fast one.
Exactly,
okay.
Get it all out fast, all right? So breath in for me, all the way out, good. Yeah, there was a little one there, we got it. Let's see if there's any more in the lumbars. Breath in, all the way out. There's one more hiding in there, perfect. So pull, scooch towards me, good, all right. And breath in, all the way out, good. Nice, okay, there was a big one there too, good stuff. Okay, so I'm gonna get you to just relax as best you can, drop, and yep. Little one there. Let's check for in the other side. Oh, we somehow regained some battery. We're back to 2 bars. Awesome. Maybe we will scrape. Drop the head. Good. Oh, that's a good one.
I could feel that one building as you were
getting ready for it. Yeah. All right, so as Rob was mentioning, he feels like he gets a lot of pulling, a lot of tightness on his right side every time he's kind of leaning forward in any way. So it's entirely possible that we do have more muscle tone on the right side. So what do I do in order to observe that? Well, I actually get down low and I look at the differences between muscle sides, okay? We do have a little bit more developed in through these paraspinals as compared to the left side. I don't know if that's the cause of it, but patient reports more tightness on the right side. So what do? Well, we can massage it, which this, again, you guys are familiar, is my favorite way to do that. So we're gonna start just like that. Now, if I am pressing too hard, you let me know, I'll back off. But yeah. Now I forgot to mention off camera, I usually like to ask the patient something about themselves while I'm doing this. Is there anything about yourself that you're proud of that you want to talk about, or would you rather just kind of skip over that question?
Oh, let's skip that.
Let's skip that, okay. All right, well.
Unless you want 10 seconds of silence for the video. Great little smash cut.
We're going to be doing 10 seconds of silence and then some for the ASMR component. So might as well just fall silent and enjoy that, okay? After I get my sniffles out of the way. Now we're silent. Right in through there, huh?
Mm-hmm. This will be where the royalty-free music comes in.
Usually we just be quiet for this one, but the teens deadlifting in the back, you know how it makes that harder to do.
Nice little Benny Hill theme over all this.
And I can't get called for copyright on it.
Throw it on fast forward, boom, you got yourself a video.
One thing worth pointing out here is that Rob is starting to get that petechiae, that redness in his region of greatest complaint. So we definitely have a fascial component on this right-sided tightness or stiffness that he's been experiencing. So I think he will get quite a good deal of benefit if he's able to be consistent with this. You know, if you're okay with that, we're also going to do some in the lower back too.
That'd be great.
Perfect. We can do that then.
As you were doing that, I could actually feel like not blood flow, but the idea of blood flow going down my leg there.
Sure, we can absolutely promote more idea of blood flow. Totally for it. Yeah. If this is too much, you let me know. I back off.
No, you're good.
Okay. Rob, how did you find all of that?
I thought it was a really good experience.
Yeah.
I've never ever been scraped like that
Okay.
before.
Yeah.
I didn't know what to expect, and it was very calming. It really felt like it was complementary to the other stuff. Like, I kind of rambled about it, but when you were scraping up top, it felt like I could feel like a flow return, like alignment or whatever. I could feel things sort of returning to my leg, if that makes any sense whatsoever. And then when you did the lower back, it just felt like it was putting the rest of it in place.
Yeah, so when I'm doing the tools on someone, it targets what's known as the fascia, okay? And I've talked about this 1,000 times. The fascia creates chains all throughout our body, and that's how we can get some complaints in one location that will affect another location entirely. So usually I see it within like lower limb issue. If you can't trace it back to nerve, if you can't trace it back to muscle specifically, you can get restrictions in fascia up top, which can then affect lower down, such as in the calf, for example. In this case, it looks like we might be dealing with upper back regions, then stretching down into the lower limb, which I personally have not seen before. But if you report that you felt improvement in your leg following that scraping of the upper back region, like what the patient offers should be taken at face value. He clearly felt improvement there, so it's something we should include going forward in a treatment plan. Do you have any other thoughts or questions?
Just any steps I could take on my own to sort of stretch things out, deal with these knots that I can't necessarily get to with one hand or something.
So there are several, I mean, like there are a million different ways that you can stretch a thing. Okay, you can YouTube stretches for upper back, and you'll be shown a bunch. I'll show you a couple off camera, just because we are unfortunately running low on battery on the mic and storage space. I really got to see it all that. But there are things we can do. With the ankle specifically, there are also resistance training exercises that we can do with the resistance band that you mentioned that you bought. Okay, so I'll show you through those. The ankle itself, it does dorsiflexion, it does plantar flexion, it does eversion and inversion, so we can work through those directions too. But absolutely, the self-rehab and self-management of complaints is really, really key in just about every conservative treatment plan, because otherwise you're just going to become dependent on the practitioner alone, and that's not good. All right, like, I mean, you don't have infinite time, you don't have infinite resources to keep going back and seeing somebody. Your practitioner should be giving you tools in order to self-manage your condition. So absolutely, we'll come up with some for you, no problem. Any other questions? Any other thoughts?
I don't think so.
No? All right. Well, thank you so much for coming in today, Rob. We can end on a high five. Oh, do you want to?
Oh, hey, whatever you want.
High five. We'll do a high five. Boom. There we go. That was a good one. That was, ow, my hand. Okay.
All right. Don't forget to like, comment, and subscribe.
Thank you, Rob.